I'm very pleased to invite Dr. Arvind Gupta, our 13th President and Vice-Chancellor of the University of British Columbia and Professor of Computer Science. Arvind.
I want to thank all of you for coming to this meeting and welcome you all to our beautiful campus here in the Okanagan. I'm sure you've had a chance to walk around a little and see what a great facility that we've created here. And of course, this conference is really timely. It's a chance for us to think about the whole issue of health promotion, the issue of how we create sustainable communities, both on our campus and the broader community, to exchange ideas and learn about best practices, but also to think about the future. How do we push this agenda forward? I just learned that we have participants from 38 different countries in almost every province and territory of Canada. So this is truly an international meeting. And so let me say to all those who traveled here, especially from far away, how much we appreciate the effort you took to be with us for this meeting and to share your thoughts with us. You know, as universities and colleges, as institutes of higher learning, we have an obligation to create campuses that foster a sense of healthy living, well-being of our students, promote a safe environment. But I think we have more than that. We have an obligation to make sure that our students leave our campuses understanding how they can be agents of change, how they can catalyze transformations for the rest of their lives, and make sure the communities they go into, and whether those are physical communities, the cities they live in, or the workplace community that they'll be a part of, what their role can be in promoting healthy living and well-being. As universities, we also have a responsibility to take the research that we do, and Kathy McLeod talked about how critical it is, the research we do, but then figure out how we translate that research into the broader community, how we set the agenda, how we promote best practices, and how we are in some sense the guardian of making sure that the standards are being set for these issues. I don't know if anyone's talked with you about the UBC Medical School. We have one of the most complex, I would argue, medical schools in North America. We use a distributed training model that operates in 4 different cities of this province, in Prince George, here in Kelowna, in Victoria, and in Vancouver. And the goal is to make sure that we get physicians situated throughout the province. And creating a seamless medical school in this very distributed way, of course, has challenges, but it also has many opportunities. It means that we're doing cutting-edge research in very large urban settings and small settings, that our students are able to share information about what creates healthy living in really diverse areas. It means that UBC is contributing to health across the gamut of activities in this province, and I very much hope setting a standard that can be translated right across Canada and then around the world. I'd like to talk with you about one aspect of healthy living. Our campuses, we have 2 campuses, are located on the traditional ancestral territory of the Musqueam people in Vancouver and the Okanagan people here in Kelowna. And because of that, UBC takes a special responsibility to promote health among Aboriginal communities. The reality is that the health of the Aboriginal population in Canada lags behind, and sometimes significantly behind, the broader population. And we can look at that in all sorts of measures. We can look at life expectancy, infant mortality, youth suicide, diabetes, but we have some real challenges in front of us. And as you have been thinking about this, I'd also like to think about what this says to our responsibility to the First Nation peoples of Canada, because I think we have to be very proactive in taking on some of these issues. Already at UBC, we've made a commitment to significantly increase the number of Aboriginal doctors, nurses, dentists, physiotherapists, other healthcare professionals. Earlier this month, we announced very generous gifts of $2 million from some of the friends of the university, and that included $1 million from the UBC Chancellor, Lindsay Gordon, to support the UBC Center for Excellence in Indigenous Health. And the whole goal of this center is to think carefully about how we can boost Aboriginal health providers, optimize our curriculum to reflect the reality of Indigenous communities, and also make sure we're doing research in some of the very unique challenges that the Aboriginal community faces. As I was thinking about this program, one thing that jumped out at me is how issues like sustainability and health are so intricately linked. And at UBC, we have a very large initiative around sustainability, but I think that there's an opportunity through what's happening here to link that into the broader question of well-being on our campus. One very novel thing that we're doing at UBC, especially around sustainability, is using our campus as a test bed for experimentation to think about the research coming out of our labs and how it can be used on the campus, really integrating the academic mission of the university with this broader question of well-being. We're very proud at UBC that we exceeded our Kyoto targets 5 years early, and that we're on track to become a zero-emission campus by 2050. And we're already working very hard to explore how the learning we've done around sustainability can be translated to the private sector, to the communities we're in, and to other cities around the globe. I think that, as we mentioned earlier, there's significant challenges ahead, but significant opportunities to form partnerships with communities and government, and have universities and colleges act at the nexus of those partnerships so that we can make sure that the impact of everything we do really is felt in the broader community. So thank you again for all being here. Thank you so much for inviting me to speak with you today. I know that there's lots of work going in to develop the Okanagan International Health Charter, and I'm planning to come back today at 3 o'clock to see the fruits of that labor and then join you in signing of that charter this afternoon. Thank you.